Welcome to this short tutorial from Pathology Made Simple at ilovepathology.com. In this session, let's learn about squamous papilloma. We will see what is the definition of squamous papilloma, what are the various sites where papillomas can occur, what is the etiopathogenesis, the clinical features, the morphological features, and a bit about treatment of squamous papilloma. So, what's squamous papilloma? These are benign growths that occur on the surface of skin or mucous membranes. Basically, they are characterized by finger-like projections, or they are called papillae, and each of these papillae are made of an overgrowth of squamous epithelial cells. So, remember, squamous papilloma is basically finger-like projections, and these finger-like projections are made up of overgrowth of squamous epithelial cells. So, what are all the various sites where squamous papillomas can be seen? They include skin, particularly in areas that are frequently exposed to sunlight, such as face, neck, arms, and hands. So, this is one such example of squamous cell papilloma involving the fingers. So, it can also occur in oral cavity, in the mouth, particularly on the tongue, tonsils, the inside of the cheeks, and sometimes even the palate, as you can see in this particular photograph. The third important location where squamous papillomas are seen are larynx, which can be seen on the vocal cords and even on the other areas of the larynx. In this case, you are seeing papilloma arising in the vocal cord. So it can be seen in genital areas, which includes the penis, the vulva, vagina, and the anus. It can also be seen in the nasal cavities and sinuses, and can be seen also in hollow visceral organs like esophagus, where you can see these mucosal protrusions. So these are the various sites where squamous papillomas can be seen. So, what is the etiology of squamous cell papilloma or squamous papilloma? They can be caused by a variety of factors, but infection with human papilloma virus, is the most important cause. And other causes could be smoking or exposure to other irritants. Among the HPV types, the type 6 and type 11, these are the most common causes of squamous cell papillomas, particularly when you're looking at oral cavity and respiratory tract. So let's look into pathogenesis. Once these papilloma virus infects the cells of the skin or the mucous membrane, what they do is they basically involve the viral oncoproteins. The most important viral oncoproteins being E6 and E7 viral oncoproteins, and these oncoproteins interfere with the normal regulation of cell growth and division. Okay, once they have this interference, ultimately the end result is formation of abnormal growth, and that leads to the formation of papilloma. Okay, if you want to learn more about the pathogenesis of HPV induced growth, I have talked in detail in the topic cervical intraepithelial neoplasia and cervical cancer. You can watch that video. I will be providing the link in the description below. How do these papillomas manifest? Usually, they're typically asymptomatic, but sometimes they can cause pain or tenderness if they are located in areas of friction, or if they are located in areas of pressure. They can occasionally bleed, and they may cause cosmetic concerns. If it is present in the mouth or throat, they might cause difficulty in swallowing. It can cause hoarseness of voice or change of voice, particularly when they are involving the vocal cords, right? So the clinical manifestations depends basically on the location in which the squamous papillomas are seen. So how do you diagnose squamous papillomas? Just by simple physical examination, you can diagnose squamous papillomas. They are typically characterized by projections. As you can see here, they are characterized by projections which extend from the surface of skin in this case, or the mucous membranes in these cases, right? This is in the oral cavity, this is in the vocal cord, that's in the esophagus. So they are characterized by projections which extend from the surface of skin and the mucous membrane. And these projections can be smooth like this or even irregular, as you can see here. The color of these projections may vary from flesh color to pink or even red color. The size also can vary. It can be as small as few millimeter and can be as large as many centimeters in diameter. So ultimately, when you see these abnormal growths, the only way you can diagnose that this is papilloma and not anything else is by performing a biopsy and histopathological examination. So what do you see in histopathology? Basically, you see these finger-like projections of the epithelium, and these finger-like projections are known as papillae. Okay, and these papillae, remember, they do have fibrovascular cores, and that is called as papillomatosis. The first important feature is papillomatosis, which is formed by finger-like projections, and they are called papillae with a fibrovascular core. The second important thing is that you can see increase in keratin layer. Okay, marked increase in the keratin layer, that is stratum corneum. You can see that, and that's called hyperkeratosis. The third important one is there is increase in the thickness of the epithelium. That means there is increase in the number of layers, and this is known as acanthosis. So what are the features? You find papillomatosis, you find hyperkeratosis, you find acanthosis, and often you might find these important cells. These are enlarged squamous cells with a very clear cytoplasm and resin like nuclei. Okay, so that's how you see in between these epithelial cells, and these cells are called as coilocytes. They're very pathognomonic of human papilloma virus infection. And what are these coilocytes, and why are the nuclei like that? The nuclear membrane is wrinkled, it shows wrinkled appearance, and that's why it's called resin. Resin basically means a partially dried grape. Okay, the nuclei of coilocyte looks like that of a raisin. It's because of wrinkled appearance. Remember, coilocytes are seen in human papilloma virus induced squamous papillomas. So these are the important histopathological features of squamous papilloma. This is an illustration showing papillomatosis, hyperkeratosis, acanthosis, and you can see these coilocytes. So, how do you treat squamous papillomas? Often, no treatment is required. Sometimes it may regress spontaneously, but then again, if they are symptomatic and if they are, interfering with your routine activities, then you have to treat these cases. How do you treat them? Depending upon the location, they are treated either by cryotherapy or by excision of papillomas. So that's all. And that's about squamous papilloma. We looked into the various sites, pathogenesis, the clinical features, the morphological features, and then the treatment aspect of squamous papilloma. Thank you for watching. If you like this video, hit the like button. Do comment in the comment section below if you have any queries, or if you have any suggestions for further topics to be covered. Don't forget to subscribe, and then please do share if you find this video useful. Thank you.